Dr. Jennifer Mills-Price. I'm a psychologist with Marshall Psychiatry, and I'm also the program director and therapist at the Maternal Addiction Recovery Center, or the MARC program, which is a partnership between Marshall Psychiatry and Marshall OBGYN, and we're on the outpatient side at the Cabell Huntington Hospital. We provide medication-assisted treatment for pregnant and early postpartum women with opioid use disorder. Well, hi, Rhonda. Thank you for joining me today. So usually you come visit us in the MARC group room, but because of the pandemic, we're doing things a little bit differently. So I'd like you to introduce yourself and tell me a little bit about Lily's Place.
Okay, well, my name is Rhonda Edmunds, and I'm the Director of Nursing here at Lily's Place. And we care for babies who have been prenatally exposed to substances that cause a withdrawal process after birth. So our goal here is to make that process as comfortable as possible, but also as quick as possible. Oftentimes, these babies require medication, so there is a weaning process to that medication. And we also use therapeutic handling techniques and a low stimulus environment. We have private rooms here, so hopefully that makes parents feel a little more comfortable with visiting and being able to spend time with their baby. We also want to work with the families, with moms and dads, so that wherever they are in their recovery, we want to be supportive of them. We do have a peer support specialist here that can help them in any way she can. Our nurses are, of course, trained in the care of the baby, but also in the education that the parents might need. And, we are good listeners. So if moms just want to vent to us sometimes, then we're here for them to do that as well.
I know that prior to co-founding Lily's Place that you had experience at the neonatal therapeutic unit here at Cabell.
Right.
What do you see as being one of the main differences between the NTU and Lily's Place?
I feel like the main difference is that environment, just getting out of the hospital and that hospital feeling. All of our nurseries, like I said, they're private, but they're decorated like nurseries that you would have at home. So we do want the moms and dads to feel comfortable here. We're able to control the environment a little better since there's only one baby in that room. So, the baby next door is not crying. We also have a little bit different staff-patient ratio, so that we have more staff to patients than what they're able to do at the hospital. We have RNs here, and we also have patient care assistants. So we want to be able to maintain that therapeutic environment and get to the babies quickly whenever they're crying. Because we found that if the babies have to cry for very long, then oftentimes it's difficult to get them composed again. So those are really the main differences. I mean, we do have that on-staff patient or peer support specialist that is available to the moms. And we have our new family center that's opening. So hopefully those will be some services that will benefit moms as well.
Yeah, so it sounds like a family-friendly type of environment.
That's what we're shooting for. We want that family approach.
Okay, excellent. What would you estimate to be the average length of stay for a baby in your program?
It kind of depends on the baby, of course, and at what point we get the baby here from the hospital. But the average length of stay from the time the baby starts on medication to the time the baby goes home is usually somewhere between 25 and 30 days.
Mm-hmm. And when they're there, what do the nurses do to help the babies?
Well, we have the scoring system that we look at, and we use the Finnegan score as well as the Eat, Sleep, Console. So the Finnegan score just helps us see how bad the symptoms really are. And then the Eat, Sleep, Console assessment helps us to see how comfortable the baby is. So that if they're having lots of symptoms, but they're still able to eat and sleep and be consoled, then if there's a question about whether to wean the medication that day or not, then we're going to lean toward weaning it because the baby seems to be pretty comfortable. We do have a protocol here that we follow, that the doctors go by that to determine, if it's time for the medicine to be weaned. But again, we want to look at the whole big picture and see what the baby really needs. So there's the baby kind of drives the whole process of getting off the medication. And of course, the nurses give the medication and communicate with the doctors to let them know, what's going on.
Yeah, so I think that scoring system that you just described is a little bit different than if someone had gone through this process, say 2 or 3 years ago, where it was more based on the Finnegan score alone.
Right.
And now you're looking at the baby's comfort level also.
Yes.
Yeah. How do you involve the parents or the family members in the baby's care?
Well, one thing we have discovered is just how important that family is to the baby. And mom is part of the treatment. So we'd like for parents to be here as much as they possibly can and be as involved as possible. 8 of our nurseries actually have twin-size beds in them, so moms can stay as much as possible. When we first did this, we started out kind of like with a rooming in program that, you learn as you go. Some of those guidelines we had were pretty restrictive, and moms had situations at home with like other children or transportation, things like that, that made it a problem. And of course, that was not our goal at all. We wanted to allow moms to be here as much as possible. So we've kind of lightened up on some of that, and we just see the rooming in as an opportunity for moms to be here whenever they can. If it is 1 night a week, then that's great. And if it's 7 nights a week, then that's great too. So again, we want moms to have that ownership of their baby and truly be the primary caregiver. So they're going to be changing diapers, they're going to be feeding, they're going to be getting their baby to sleep. We're going to teach them about the therapeutic handling techniques and let them implement them. So really, we would like to be here just to provide the education, do the assessment, give the medication, but we want the mom to be there as much as she can. And of course, we're going to step up and take care of the baby whenever she's not here. But we really want that family involvement.
And so as far as the mother, there's pretty liberal visitation, even overnights.
Yes.
What are your other visitation policies? Who else is allowed to visit?
We have regular scheduled visitation from 8 a.m. until 11 p.m. And that allows dads to be able to visit during that time. And right now, because of COVID, we have limited visitation to 2 people, mom and dad, or if there's no dad involved, then mom can choose a different significant other. Oftentimes it's her mother or sister or something like that. We don't have that policy of, once you leave, you've left for the day, you can come and go as you please. We do, with the COVID, we have the screening where everybody gets their temperature taken, everybody has the questions asked to you about have you been exposed? Do you have any of these symptoms? Those types of things. We were allowing sibling visitation prior to COVID, and hopefully we can get back to that again very soon. And also we would like to be able to involve grandparents and, other significant people in that baby's life. But, we're moving toward that with the COVID.
Yeah,
version.
So right now, mom gets a lot of opportunity for visitation and involvement. And then there's still very liberal, I would say, visitation hours compared to other parts of the hospital. for the other support person, whether that's dad or someone else that is appointed to be the support person. And because of the pandemic, there's no visitation for siblings or extended family. But as things are safer to open up, that's might be a possibility again in the future.
Yes.
Okay. Tell me a little bit about breastfeeding policies. Is it allowed, and what are the requirements for the mom to be able to breastfeed?
Breastfeeding is allowed. We do same policy as the hospital simply because, we do like to have those consistencies with the hospital. And so it's the 90 days of appropriate screening that mom has to have evidence of, and no marijuana use. But I'm actually going through training to be a breastfeeding counselor. So I'm hopeful that we can get more moms involved with breastfeeding and let her know prenatally what's needed so that she can be working toward that while she's still pregnant, and she can have those the screens available to the staff at the hospital so that she can get breastfeeding started and just can be continued here. We do have a breastfeeding room here where we have a recliner and pumps and that kind of thing. So we do want to promote that.
Mm-hmm. I noticed that, I would say probably about a year ago, a little bit before the start of the pandemic, I saw some moms starting to take part in the breastfeeding at the NTU and at Lily's Place. And that can be a great motivator to have those 90 days of screens with only their prescribed medications, making sure that they're not on any medications that would be contraindicated for breastfeeding. And their MAT medications, the buprenorphine, is safe. But we do emphasize that marijuana is one of the substances that is definitely not safe for breastfeeding.
Correct.
So they should discontinue that in advance of the 90 days because it can take time for that to get out of their system.
Yes.
Okay. So how and when can a baby be referred to Lily's Place after they've been born?
Well, moms can request for the babies to come. She can let the nurse know that she would like for her baby to come to Lily's Place. She can let the physician know. She can even call here and let us know she would like to come. Some moms, even while they're pregnant, they'll come here and do a tour of our facility and even pick out a nursery, things like that. And then once the baby comes, it's an easy process. If there are moms who don't know about Lily's Place, so the physician, once the baby is started on medication and typically is on step 3 of the protocol, then the physician will let mom know about Lily's Place and about Lily's Place being an option. And then we can get the process going. We have to get prior authorization from the managed care companies. So that can take a day or two sometimes, but that can either be facilitated at the hospital or we can do that.
Yes, so really anytime during pregnancy, the mom can learn more about Lily's Place. And are we still doing tours during the pandemic?
Actually, we have allowed that. And again, we do the screening prior to the tour. But we want moms to feel comfortable and know that this is an option.
That's great. And then once they've made that decision, to let the baby's treatment providers know as soon as possible, whether that's at delivery or when the baby gets started, the weaning process at the NTU, to talk to the baby's doctors to let them know that that's something that you're interested in. And it'll take a few days for them to get to the appropriate step. But when that happens, they can be moved to Lily's Place.
Yes.
Yes. Okay. How do you work with families who have a CPS case?
Well, our support specialist is kind of taking that role right now. We are hiring for a case management position. And that's what she would typically be doing. But our peer support specialist is great at that because that mom needs support during that time of working with CPS. We do communicate a lot with the workers, letting them know how well mom's doing, that she's visiting often, she's appropriate with the baby, things like that. And if there's a mom who finds herself in a situation where she may not be able to take her baby home at this time, maybe she's not at that point in her recovery, then our peer support specialist is going to work with her and with CPS to find out what she might need to do in order to be reunified with her children and help her to achieve that.
So you have folks on staff who've been through the recovery process herself and can kind of help provide support and guidance to the moms. And it sounds like you're really supportive that as long as it's safe, you want the baby to go home with mom also.
Definitely, yes.
Yeah. What advice would you have for parents who want to bring their baby home as soon as possible, who are going through that situation?
We would just want to encourage them to be here as much as possible and to know that a lot of our moms say that they just feel so guilty when they can't be here because of, other kids at home or they have transportation issues. And to know that we understand that and no one is judging them about their not being able to be here. So we just want to encourage them to be here as much as they possibly can and to understand how important it is for their baby, for them to be here, and how that does speed the process along. We have seen babies do so much better with more parent involvement. And we're just going to encourage them when they're here to do the therapeutic handling, to maintain that calm environment, so that helps the baby along in the process as well. And just be patient and hang in there. And, it will happen. They will get home, and that we're all on the same team and we're all wanting them to get home as quickly as possible.
Yeah. So I want to try to review some of the services that we've already talked about. So there's the medication management for the babies. Educating parents about therapeutic handling and how to soothe the baby and keep them calm and support them through that process. Breastfeeding support, peer recovery coach services. And is there anything that I'm leaving out?
Well, with our new family center, we're going to have counseling available. And that can be just your regular counseling. We also have some spiritual counseling that they can be involved in. We understand that with the managed care companies, or not managed care companies, with the MAT programs, there's often a certain amount of counseling maybe that is the parents are able to participate in. And we would like to, even if there's no billing for it, we still want to be able to provide more intensive services if that's needed for the moms to help in their recovery. So that will be a good thing. For babies, we have a follow-up clinic. So that's kind of a service for them. And it also helps the moms because they're able to bring the baby back for a follow-up clinic to meet with Dr. Mitzi Payne, who is a pediatric neurologist. And we also have a physical therapist here at the time because sometimes babies have lingering effects like increased muscle tone, and that can cause delays in their development with even sitting up or crawling or walking. So we want to catch that early and help them meet those milestones. We also do a referral to the 3 and right from the start to see if there's any needs that the baby might have, education for the parents long-term after the babies are home. We also keep in close contact with the families, and a lot of our staff, after babies have gone home, they'll be friends with the families on Facebook. So if there's any needs that they might have, they can just reach out, whether it be diapers or wipes, baby products, whatever, or, if they need to talk to somebody. We feel like we do develop some close relationships with the families that are long-lasting.
Yeah, so there's a lot of support even after baby is discharged and no longer a current patient. You're kind of part of the family for
Yes, that's what we tell them.
yeah. Okay, well, Rhonda, thank you for joining me. I don't have any other questions. I think you've done a great job. Is there anything else that we missed that you'd like to say?
I think we covered it. I mean, we want families to know that we're here to help. I know this can be a stressful time, and we want to be just a group of people that help make this a positive experience.
I do want to emphasize, because of the context of the videos, that even though I work at a Marshall Health program, that's not a requirement for your baby to go to Lily's Place. I just want to make sure that's clear, because we're going to have different therapists that are working throughout this video series. All right, thank you.
All right, thank you.